COVID-19 cases are on a rapid rise. Gauteng is the epicenter of the pandemic, and the number of cases, the local epidemic that is, and the number of cases has passed the 100,000 mark. According to the South African Medical Association, the pandemic is overwhelming hospitals with workers suffering burnout. Numerous panels have been set up to deal with the crisis. Joining me now via Skype is the South African Medical Association's national chairperson, Angelique Coetzee, to talk about this. So, Angelique, when we say healthcare workers, such as your members, as SAMA, are getting burnt out, what do we mean exactly?
Good morning and good morning to all the viewers out there. Yeah, it's indeed a sad time. When we're saying that our healthcare workers are getting burnt out, we are meaning that there is less doctors available to do the shifts. Therefore, the ones that are there, some of them needs to work double shift or needs to work overtime for quite some hours. You have to understand that during the COVID time, when you are dealing with a patient, especially in the casualty units or at primary healthcare unit level, some of these patients or the families can be extremely difficult and demanding. The patient itself normally very sick, and then you as a doctor need to help and care for that patient with limited resources. There's other patients also wanting to come in, needing your attention. So the emotional burnout on these doctors and nursing staff is enormous. And if we do not address that, we are going to lose young doctors by emigrating, or they just get so disillusioned that they will leave the medical work that they are doing and go out there and do something else.
Sure. Talk to me about the setup in as far as the public health institutions are concerned. In terms of amenities, for example, I know that the hours in terms of how they are structured for doctors are rather strange in that, they tend to be really long hours starting on one day and ending, on the next day. But you can talk more authoritatively around that, the way that the hours are structured, but also at the same time, the amenities at the hospitals. For instance, if a doctor wants to take, say, 10 minutes of just, 10 minutes to just take a 10-minute break, what are the facilities that are available for them in public hospitals?
Some of these facilities are great and some are poor. So it depends on which hospital you're talking about. It depends on the hospital manager. It depends on the management of the hospital. How sure did they make sure that there is enough relief for doctors and nursing staff to rest? Currently, a lot of them doesn't have the proper facilities. Also, you need to understand, if there's not a proper facility where you as a doctor can take a 15-minute break or just sit and there's no one coming in, that you get your thoughts together and that you get yourself, come back to yourself. If that's not allowed, and if there's not breaks in between, allowing these doctors to just relax for a few minutes, you're going to get the doctors getting irritated, the nursing staff getting irritated, and they just carry on, and it becomes like an automatic robot. Just do your thing, go home, lie on the bed, get up next day, go in the same pattern, starts over and over again, and you will get a lot of people who cannot handle the stress, to develop either major depression or PTSD.
Yeah, and while you're talking about PTSD, the number of patients who are dying, we've seen in the Western Cape and here in Gauteng and in the Eastern Cape, in fact, across the country, the numbers keep rising. I imagine this must cause a great deal of turmoil, emotional turmoil and psychological turmoil for people who take an oath to preserve life, just seeing people die, without being able to help them.
Yes, you are absolutely correct. So there's actually two things to this. The one is the emotional trauma that you experience by trying to do your utmost best with limited resources. And then the second trauma is when you know that you can actually help this patient if the hospital was properly equipped with the right equipment and the right staff, the right attitude. You could have saved this patient. But you don't have the luxury of that. Someone mentioned the term bush medicine. And I think that in a lot of the hospitals, the doctors and the nursing staff is going back to bush medicine, which is absolutely unacceptable. SAMA also now, since last week, we released a website, and I am pleading to all doctors and healthcare workers out there, make use of this. The website is called whistleblower@samedical.org. And thereby, please supply us with photos, proof of what is happening, and in your hospital facility. We promise it will be anonymous, and we will then address it either in the media and with the Minister of Health.
Yeah.
Because this cannot carry on.
So, lastly then, let me ask you what your attitude is following the announcement of the reimposition of a ban on the sale of alcohol, which, the justification is that lifting the ban was putting a strain on the emergency wards and the trauma units, as well as the introduction of an overnight curfew. What's your attitude then, given everything that we have talked about in as far as healthcare workers are concerned?
Okay, the problem with the ban of alcohol, it is secondary to a much bigger underlying problem. So if we do not address the underlying problem, which has been here for many years in South Africa, if we do not address that, you can ban alcohol as much as you want, because every time when you lift the ban of alcohol, the underlying problem is still there. You have to address the underlying problem. Then also, the ban of alcohol, and SAMA is not for alcohol, please don't get us wrong, but there should have been a better method of handling this than just put a ban on it again. I call it the elastoplast method. So we put the elastoplast on, but underneath the elastoplast, the wound is still festering. We have to address the primary problems. Yes, for now, it's going to help us to breathe again a bit in the casualties. But you cannot have the ban of alcohol forever and ever and ever, as well as with the cigarette ban. Somehow you have to lift it again. And you haven't changed any behavior. You have not addressed that. And then, and that is a problem.
Yeah.
The curfew, SAMA a long time ago said there should be a curfew. But the current curfew from 9 till 4 in the morning, I don't know whether that curfew is really going to make a huge impact or difference. As if you look at young people, most of them like to gather socially, and they will start gathering most probably just before 9 o'clock at night, and then leave next morning just after 4, because it's legal. So we need to address the problems.
Sure.
And if we don't address the problems, we're not going to win.
All right, thank you for that. That is Dr. Angelique Coetzee of the South African Medical Association, giving her perspective on the number of issues that are in the healthcare sector, both public and private.